Okay, we're going to talk about gout, the curse of keto and carnivore. It's something that most people don't want to talk about. I mean, I totally praise and value the ketogenic lifestyle. I believe it did save my life. I believe it was an incredible change in my life. However, once you come on board with something, it seems like everybody has to say just the good things and not the bad things. There are thorny issues, and one of them is uric acid. Absolutely uric acid. If you're just coming from a standard American diet, maybe you already have a uric acid problem, and perish the thought if you have gout. But if you're not foretold that your uric acid is going to go spikingly high on keto, and then it's going to come down and normalize and be wonderful. However, you got to get ready for some rough riding to make that transition. For carnivore, it's a little bit different, and we're going to get into it, okay? This is what nobody wants to talk about. What consuming too much organ meat can do for you if you're on carnivore. Or is this not the entire story? Gout, once the disease of gluttonous aristocrats. Gout is now tormenting the masses. That's from a New York Times article in 2020, just about the time of the pandemic started. A year into it, actually. It can be tempting to ascribe the affliction's prevalence to our current climate of indulgence. But that's not the full story, not at all. From the 1960s to the 1990s, the number of sufferers more than doubled in the United States. And it's continued to rise, so it's become much higher. So we're asking the question, why? Why is that? It's all about uric acid, is it? What does this tell us? So recent attention on uric acid has been, in my view, a bit misleading and incomplete. But you do need to know what causes hyperuricemia, elevated, out of range uric acid as a blood test. And what causes gout? They're related. Problems from high levels of uric acid is the risk of dementia and Alzheimer's. Boom. And by the way, this is from a study. This isn't just me going on and saying, hey, this would be interesting to talk about. It's the risk of dementia may be increased with high uric acid levels in elderly people. And you have to think about its high uric acid levels in elderly people that probably had it 10 years ago, that probably had it 20 years ago, that probably had it 30 years ago. They weren't alive 100 years ago, and that would be a whole different thing. It's thought that the normal levels for uric acid 100 years ago were about 3. Right now, the average by lab tests in the United States, it's 6. So that was from uric acid and incidence of dementia over a 12-year follow-up, and that was a French-European study. Okay, gout and the risk of dementia, a nationwide population-based cohort study in 2015, a different study saying the same thing. This is from Taiwan. I wanted to get them different locations so they weren't like the same group of people doing the same sort of work on the data. So the abstract is uric acid was proposed to have an antioxidant property and possible neuroprotective effects. We examined the association between gout and dementia with population database. So gout and dementia, not necessarily uric acid and dementia. What did they come up with? Gout patients had a lower risk of developing a non-vascular dementia or vascular dementia, lower risk of dementia. Now, why is that? So I just said gout. And you're thinking, well, gout and elevated uric acid are assumed. We'll get into this. So conclusion, patients with gout have a lower risk of developing dementia. This phenomena exists for both vascular and non-vascular. And I will get to the answer why that is by the end of this video. Okay, factors that affect your uric acid, UA. What triggers gout from the conventional medical perspective? Something that causes a flare in one person might not do it in the next, and I totally agree with that. That's kind of rare for a conventional medical perspective to say something like that. But common triggers include heavy alcohol use, especially drinking beer and hard liquor, foods high in purines. Purines are the breakdown products of RNA and DNA and ATP, including red meat, organ meats like liver, and some seafood, including shellfish, sugary sodas, food with fructose, a type of sugar, some drugs that are used to treat high blood pressure, leg swelling, or heart failure also trigger elevated uric acid levels and gout. Fasting and dehydration. So fasting and dehydration, that shouldn't be all that unusual. Think of fasting as the first steps of a ketogenic diet. Because what happens when you go to a ketogenic diet, you're dropping your carbs. So your glucose drops down and your insulin drops down. So that's like a fast in that sense. And so consequently, what are you left for energy? Start burning fat. So for the transition from carb burning to fat burning happens slowly. Certainly happens pretty painfully over 3 days if you're just coming in from left field, the standard American diet. But your ketones will go up. As your ketones go up, your uric acid is going to skyrocket. So usually we say that it takes about 90 days to straighten that out. So if you do have gout, or you know you have elevated uric acid and you're going to keto and you're on medication, I would stay on the medication for the first 90 days, regardless of whether you had pain or not. Just do it. And then you can come off it, because then you would have made the transition into fat burning adequately enough. And dehydration, anything that has to do with kidneys, which is really what this is, if you are under fluid, if you're not drinking enough, you're going to have concentrated anything in your blood and your urine. And so we're talking about uric acid. And so if you are concentrating, if you're not drinking enough, you're dehydrated, you're going to concentrate, meaning increase your uric acid. So that is a trigger in itself, dehydration. Here's what we do. Here's what we know regarding gout. When we combine all the available science and common sense, that's rare, we can say that human beings must be well adapted, as all animals must be, to eating purines. Animal meats, right? So that shouldn't be a big deal, eating purines, which are found in all whole foods. Well, they are specifically. It's the breakdown products, all cells have that, so it's breaking down. So it's likely that we are poorly adapted to be able to handle too much refined carbohydrates, i.e. processed foods, and too much alcohol, which have really never existed in nature in significant amounts. High uric acid levels alone are not enough to cause gout. In fact, most people with high uric acid levels never develop gout. Oh, really? Conventional perspective continued. If you have a flare, medications can ease pain and swelling, and these include colchicine. Colchicine is easily become toxic. It is a gout medication, most effective if taken right away. Stomach problems can occur. More serious ones can happen too. Yeah, that's an understatement. Steroids, that's corticosteroids. Corticosteroids is steroids, as prednisone taken by mouth, or it can be injected into the joint. That's a painful thing to do. NSAIDs, non-steroidal anti-inflammatories, are partially helpful, but do not take aspirin. Do not take aspirin. You can take ibuprofen and then take your glutathione, of course, right? Your NAC to protect your liver, and naproxen. Don't take aspirin, it makes the pain worse. Gout, known as the disease of kings, is the most frequent type of arthritis. It results from sustained hyperuricemia, elevated uric acid in the blood. Monosodium urate crystals is the name of the crystal that people feel like knives digging into their joints. Deposition in the joint structures and soft tissue. Environmental factors such as diet affect the incidence of gout. There is a relationship between the occurrence of a gout attack and of gout consumption, alcohol, and meat. This is conventional medicine, remember. And a low purine diet is widely recognized. Non-pharmacological methods of supplementing the treatment and preventing reoccurrence. So a little bit of a difference there. Here's kind of the standard picture, and I've showed this before. So what we're told to believe, high fructose, alcohol, and purines, right? So sodas, and this makes sense. We didn't have, so when we say fructose, we've always had fructose in our diet, but we haven't had high fructose corn syrup, which is the basis of all those soda drinks and all those energy drinks, high fructose corn syrup. So it's fructose is part of sucrose, about 50%. This just made it into, now you're having 70 and 80 and 90% of fructose. So it overwhelmed the system. Beer is the worst culprit of all alcohol, then spirits, and then least offending, and some say non-offending for some, is wine. And that depends on your wine, of course, quality and the amount of unmetabolized sugars. Okay, but wait a minute. There's more. Vitamin A. Where does that come from? Nearly everywhere. We'll get into it. And here's the thing that kind of ties into kind of carbs and how we're eating, certainly in the standard American diet, low omega-3. If you feel, and I certainly believe and read much about this, we evolved along the seashores of eating omega-3 foods. That's the shellfish, that's the fish of any type, and they're all high in omega-3 and all low in omega-6. However, when we have refined carbohydrates, they are soaked in omega-6, really devoid of omega-3, and that sets us up. We'll get into the details on that, but just know that. We've talked about the omega-6-3 ratio before, but this is going to be in a different aspect, but still valid. Okay, uric acid and cognitive decline, a double-edged sword. Low serum uric acid is associated with Parkinson's disease, multiple sclerosis, and ALS, amyotrophic lateral sclerosis. High serum uric acid has to do with increased levels of vascular dementia and dementia of all types in older patients. Patients with gout have decreased risk of Alzheimer's. I mentioned that before. That's what the Taiwan study said. It was decreased risks of dementia. Wait a minute, but gout has to do with high uric acid. How can you have high and not high? This is confusing, isn't it? Okay, the relationship between serum uric acid levels and neurological disorders may be U-shaped, the double-edged sword. And that was the name of a research article called Uric Acid and Cognitive Decline from Rheumatology in 2018. So here we go. Serum uric acid, here's the U-shaped. If you're low, you are prone to things like Parkinson's, ALS, and multiple sclerosis. They are known to have low serum uric acid. High is dementia and Alzheimer's. High is dementia and Alzheimer's. So here we go. What we're looking for is between 2 and 4 as your ideal range. That's milligrams per deciliter. Okay, this is another sort of kind of the same picture saying it's neuroprotective when it's low. Uric acid is neuroprotective. It's an antioxidant. And when it's high, it's toxic, kind of like everything. Take your special vitamin, take your whatever. When you're not getting enough of it, you're going to have deficiencies, and that's going to be basically a disease state. When you have too much of it, that's going to be toxic. So why wouldn't uric acid be anything different? We're not being told this, by the way. That's not the dominant view. And I'm not just talking about conventional medicine. All right, so problems with low levels of uric acid. Parkinson's disease, ALS, and multiple sclerosis. Just briefly, it says, all right, with Parkinson's, low serum uric acid are associated with non-motor symptoms and brain gray matter volume decrease. Parkinson's disease, 2021. So that's just that's barely a year ago. Uric acid is an important antioxidant in the body. Results indicated that low uric acids were statistically linked to greater severity for Parkinson's symptoms, including depression, anxiety, cognitive dysfunction, apathy, and difficulty swallowing. Based on those results, we speculate that uric acid is a protective substance in Parkinson's disease and has a broad protective effect on brain neurons. Now I'm kind of not muddying the water, but I'm saying, do you have benefits on the left and right, on the low and the high? You have actually just the opposite. You have problems when you're too low and too high. You want to get to the sweet spot. 2 to 4. Okay, ALS, amyotrophic lateral sclerosis, and low uric acid. So what they said here was there is an inverse correlation between serum uric acid and risk of death. So if they were very low, had a very high risk of death, primarily in male ALS patients. ALS patients with short duration showed a significant decrease in antioxidant level, and the metabolism of glutathione was correlated with the disease progression. I would have loved to have known some SNPs on that, but that wasn't my study. All right, so let's look at the labs. Where, how much does it cost? What you should get done specifically especially if you are carnivore, ketovore, and keto. So really there's 2 ways. You can go conventionally and go get your blood drawn and do a uric acid test. And this is a panel looking what I did last week on myself. I'm 6, I'm terrible. And there's Judi 2.4. She's, the uric acid princess. But also you now can get this meter. This meter costs about $80. And of course you got to get the strips, just like you had a glucometer and just like you had a ketometer. This is actually, if you are concerned about uric acid, I'm going to consider getting one of these because I now want to correlate this with other things. To correlate uric acid with glucose, wear a ketometer, and that would be great. But in the meantime, it's a very cheap test to get, whether you got LabCorp or Quest, and there's a link on the description to this video if you want to just go out and get it and find out where you can get it in your area. It's probably $20. I didn't look up, maybe even less than that. So it's right up there with insulin, very cheap. So a tale of 2 pathways. We're getting into it a little bit. And this is kind of the functional medicine perspective, which is better. It's not completely true, but it's better. So tale of two pathways is one is what they call AMPK, and people who are fasting, they learn about AMPK because AMPK means they're not storing any fat, right? So how you increase your AMPK is one, fasting, exercise, especially high intensity training, right? I would say slow, high intensity training. Fasting and caloric restriction is pretty much the same thing. So medications that you've heard about, metformin, a lot of diabetics are on this for this particular reason, to bring down their glucose into a more normal level. But the problem with metformin is it actually blocks B12 absorption, so you get chronically low in B12, and that sets up a whole nother level of numbers. But there have been longevity studies on patients taking metformin regardless of diabetes. Just taking metformin, will they have better lab work and have them live longer? So on the whole methylation clock and their anti-aging sort of thing, metformin has been part of it. Also, you can get the same effects through berberine, which is a natural substance. Came initially from Chinese herbal medicine. And then quercetin. Quercetin's a flavonoid, and they're very helpful as well. So lab changes, when you're talking about AMPK, because you're exercising or fasting, what you're going to see is decrease in glucose and insulin. So those who exercise, we're speaking long term, not like you're exercising right now and my glucose is. If you're exercising hard, your glucose is going to go up high because you need it to burn fast, a glycemic exercise. But with time, a couple hours later, it's going to go down. So you've absorbed a lot of glucose, and you're going to have basically healthier glucose levels. And you're going to have decreased uric acid. So the other side is, and this is kind of the natural way, and I said think of a bear, but this is how humans existed up until maybe 100 years ago, that certainly in the United States, when the winter came, they couldn't grow things. So what happens? They ate the foods they stored away. Maybe they had a cow or a goat and some other things they could actually get some daily food from. Maybe yes, maybe no. But for the most part, they had to eat the harvest food. The harvest food were the seeds, the grains for bread. So the grains for bread and the seeds food was high in omega-6. Omega-6, linolenic acid, makes you increase your fat cells. So you're storing fat. So instead of burning it in the fall, harvest time, you're now storing it, getting fatter, because in the winter you're going to have less food, and then you're going to use your fat. Also at harvest time is the fruit. Fruit's kind of the summer to late fall. You think of the peaches, the apples, whatever is in your neck of the woods, but that's how it was. So you had a higher fructose, or think of berries. You'd have higher fructose and higher omega-6. This particular functional medicine perspective does not mention anything about omega-6. And I would encourage you to go back and listen to the interview I did with Dr. Artemis Anopoulos, who's been working on omega-6 3 ratios for the last 40 years. Okay, so this is, when you're storing fat, you have activated what they call AMPD as opposed to AMPK. And so you're packing on the fat. You're getting ready for seasonal hibernation, or the bear is, however you want to look at it, and food scarcity. They're going to be sleeping for 4 months. They're not going to be eating anything. They're going to be living off their fat. So activities to do this is pre-hibernation. That's eating the harvest food, as I would say, seasonal, right? Fall to winter, prolonged inactivity. Physiology is your glucose increases, your insulin increases, your uric acid increases, your omega-6 3 ratio increases, your fructose, of course, increases from the seasonal fruits and seeds. Pharmaceutical companies are dying to create a AMPK pill, right? I just told you how wonderful it is. It was to the left side. They want that for you, and they want to give you the pill. So you don't have to fast. You don't have to do keto. You just got to take their pill. So they've realized, they realized why this is really important. They're just having difficulty getting the thing to sell. But it hasn't been easy to do. While exercise, caloric restriction, metformin, and many other natural products, interesting that you mentioned that, increase AMPK activity and exert multiple health benefits to elicit beneficial effects, has been challenging, meaning they couldn't come through with it so far yet. And that came through Nature Review of Drug Discoveries in 2019. So this is like, they're working on it right now. Just think of all the other associated diseases they would be able to bring down. So the problem is today, we are no longer prepare for a seasonal food storage, right? For the most part, wherever you live, unless you're homesteading in Alaska or someplace by yourself and have to put away all your food, most of us can buy anything we want from anywhere in the world. supply chain issues currently, but for the most part, that's true. Consequently, you don't eat a lot of fruit just at one time a year. You don't eat a lot of grains just at one time a year. Hope you're not eating grains at all, really. Or seeds or seed oils, like the vegetable oils, the soy oils, the sunflower oils, the safflower oils, the canola oils. So the second thing is we no longer have to pack on the fat to survive a winter of food scarcity. Third thing is we no longer need to eat those foods. So they ate those foods when they were fresh, helped them survive the winter. So those foods, the fructose and the omega-6, that metabolically made us fat and allowed us to survive the winter of food scarcity by being able to burn our fat, put on the fat so we could burn it. So the choices are, you have higher uric acid that leads to obesity, gout, dementia, and Alzheimer's, or you learn to avoid these foods that are high in fructose and high in omega-6, that should be linoleic acid, namely processed foods that contain or were cooked in omega-6 oils, the soy, the vegetable oils, the corn oil. So sweetened especially with high fructose corn syrup or sweetened with sugar, which is sucrose, 50% fructose. So gout's silver lining, a lower risk of Alzheimer's. I keep saying that. But people with gout had lower odds of dementia. So Alzheimer's and dementia put in the same group. Why is that? So basically, here's the answer to that for the most part. The answer is gout is kind of an early warning siren. It's an early warning alarm. Very painful, right? So suddenly they get gout and their levels are maybe 5, 6, 7, and they're getting gout. Oh, they have to do anything they can to get their uric acid down. Well, if we all knew about our uric acids, we'd all be doing the same kind of work that gout people are doing. So because they started earlier, they got that early warning sign, the pain, they were decades before the elderly we've been referring to started focusing on their gout, on their uric acid, because they don't want the gout anymore. So consequently, they did a healthy thing because it was a very painful situation. Conventionally, there are only 2 ways to treat elevated uric acid. You reduce the dietary sources that are known to increase uric acid, fructose, purines, alcohol, and then I would say these other things, but this is conventional. Block the enzyme xanthine oxidase, which is the last step in making uric acid, and or I should add this too, you block the reabsorption of uric acid as much as possible. The habit of consuming coffee can reduce levels of uric acid. Thank goodness, I'm a big coffee drinker. Still think I drink too much coffee. Because the content of polyphenol compounds in coffee, such as chlorogenic acid, and chlorogenic acid has become a very big deal. Here's a study. In 2019, lower uric acid levels subjects consuming coffee compared to not consuming coffee, and it was a big deal. They're now trying to clone that particular polyphenol in coffee because it could affect diabetes positively, get down insulin and glucose, so it's a big deal. But in this particular case, it inhibits xanthine oxidase, thus reducing uric acid levels. So chlorogenic polyphenol indirectly removes uric acid from the body by improving insulin sensitivity as well. Coffee and uric acid, this is fascinating. They're almost identical. Look at this. Uric acid, caffeine. You'd have to look at them back and forth and back and forth. I'll tell you what the difference is. There's a double bonded oxygen over here. Here, this double bond with the nitrogen. And here's allopurinol. Allopurinol is something that tries to block xanthine oxidase. And they're all pretty much the same molecule. Interesting that, eh? So elevated uric acid, hyperuricemia, and tea. Tea consumption is associated with an increased risk of elevated uric acid. So tea drinkers, as much as gout's kind of an animal thing, the tea, whether it's green tea, black tea, or whatever, is not going to work for you. And this is actually a really big study from China. They used all the tea in China. In an occupational population in Guangdong, conclusion tea consumption is an independent risk factor. Oops. Vitamin A, uric acid levels, another oops. Uric acids were significantly and positively associated with concentrations of vitamin A. Why would you care? Because you are not being told this. This is not a functional medicine approach. So I've told you about the omega-6-3 ratio. You got to get it down. We're going to go into that in a second. I'm not telling you about vitamin A. Too much obviously is toxic, but that's just not having liver. That's a simple story, and maybe that was 100 years ago. If you are having a lot of liver, like I did, you have to back off on that clearly. But what are your other sources of vitamin A? It's in your multiple vitamin. You bet it is. It's probably in a lot of other vitamins that you didn't even think it was in if you're taking supplements. It's also in face cream. And it's in your shampoo, believe it or not, as well. So you're putting it all over your body on a regular basis. That's part of the reason vitamin A is a big deal relative to increasing uric acid. And that came out in 2013. These are all pretty recent. Serum uric acid increased linearly, straight line, right? It goes up together with insulin levels. And this is what was my reference prior to really re-examining uric acid, is that it was sort of an indirect way of looking at insulin. So uric acid serves as a biomarker for glucose metabolism and metabolic disease. And that was 2013. So this is within a decade. Problems with high levels of uric acid, risk of dementia may be increased in elderly people. I mentioned that to you before. Here's another aspect of uric acid test. This is from Portugal, and they found it was basically a new way of using to differentiate people who are depressed as a mental disorder, a major depressive episode, and depression as going into bipolar, which is a whole different condition. The difference was their level of uric acid. Fascinating. So now uric acid is being used more than sort of an indirect measurement for insulin or glucose. But isn't this really just a biomarker for mental decline? So now uric acid is going to be used for a lot of other mental conditions. Schizophrenia, severe mental depression, as I mentioned, obsessive compulsive, bipolar. Basically, there's fructose. I'm not going to go through all these steps, but the last step is xanthine oxidase is used in the last two steps. And what xanthine oxidase does, it takes inosine, which is the thing that it acts on, and it makes it more soluble. So the uric acid can go out with the urine, right? When it's less soluble, it can't go out with the urine. It gets stuck in the tubules of the kidney. Okay, omega-3 to the rescue. Renal excretion of uric acid, and here's how it happens. When the kidneys don't all get rid of everything, it gets rid of everything, it pulls it back in, it gets rid of it again, pulls it back in. So it's really fine-tuning over a succession of expelling, secreting they call it, and then reabsorbing, secreting, and then reabsorbing, and eventually what's left over does stay in the urine and goes out with the urine. So I wanted to show you that. So omega-3 polyunsaturated fatty acids inhibits the urate transporters to reabsorb. So it's blocking it, saying, no, we don't want any more uric acid. Stay out there with the urine. We're going to reabsorb you. Okay, so here's good news, bad news. This is a look at all sorts of fats. The top is saturated fats and the bottom is polyunsaturated. We're not going to go too much into it, but I want to say the good news is omega-3 polyunsaturated fatty acids inhibit the reabsorption of uric acid. Saturated fats, 6, 8, 10, 12, that we love because it makes ketones, they encourage reabsorption. So having a lot of saturated fats is going to jack up your uric acid. That's the first bad thing I've ever said about uric acid, about saturated fats, isn't it? Here is another example of, this is from the same study, basically saying omega-3s decrease uric acid by inhibiting reabsorption, and omega-6 increase uric acid by reabsorbing it, encouraging the kidneys to reabsorb it. Long story short, but this is basically how that works. Okay, so it has been shown that high omega-3 to 6 ratio leads to a reduced risk of subsequent gout attacks, which means lower uric acid. Neutral, no effect. Low omega-3 to 6 ratio, in other words, you have a lot of omega-6, is a problem. Is a risk of relapse. This changes the traditional approach towards dietary treatment in the case of gout, because they were recently recommending to limit the intake of oily fish. That's exactly what you wouldn't recommend. But they were thinking about, oh, well, fish is on the list of purines. Well, no, this is the whole deal. The deal is that they're thinking just about the protein or not thinking about the fats. And you really need rich omega-3. That came out in 2020. Okay, so the effects of dietary supplemental omega-3 polysaturated fats to reduce gout flares, and that came from Boston. Take-home point here, in conclusion, omega-3 polyunsaturated fatty acids such as EPA and DHA can partially and sometimes completely or almost completely inhibit the reabsorption of uric acid by blocking the receptors. Let's look at omega-6-3 ratio and the omega-3 index, compare that to total saturated fats. This I thought is going to be interesting. Something to be aware of, by the way, the whole fat idea. So we've talked about the 6:3 ratio. We're going to talk about it again, but now let's go back and look at the foods that are on the list of, don't have it if you have elevated uric acid. So here's beef liver for one. What I want you to see is here's the amount of saturated fats. There is no omega-3. So they are all of one. We would say liver just on the oil, the beef liver, not even the calf's liver, it gets even worse, is that's probably why, not so much purines, but they were elevated saturated fats, completely saturated fats. And so for those who are in the organ meats, they're having just that and not enough of the other. Okay, and there's meats. What else? We have ground hamburger. Look at that. Look how much saturated fats it has, and it has absolutely no omega-3. That would probably be the culprit. That's twice that of liver. Amazing, huh? Now let's go to chicken. So this is the chicken of today. This is the grocery store chicken, right? So what we're looking at is saturated fats to the omega-3, clearly much higher. Here, look at the egg yolk. This is a grocery store egg yolk, has a ratio of 20-to-1 of omega-6 to omega-3. But then when you say, well, not only is it a bad ratio, terrible ratio, which is very American ratio, right? We're 20-to-1 as Americans. Look how much saturated fat it has. So if you got a pasteurized egg, which you can still get, they have a 1-to-1 ratio. Again, I refer to the conversation with Artemis Anopoulos, when she was talking about Crete. A 1-to-1 ratio is going to get you out of trouble because that's going to keep you from absorbing uric acid. That's the key here. It's going to keep you from absorbing uric acid. And by keeping you from absorbing a lot of uric acid, you're going to decrease your risk of dementia, decrease your risk of Alzheimer's, decrease your risk of gout, of course. So that's a big deal. So beef liver, we've talked about that. Now look at salmon. Salmon is pretty much, if you look at omega-3 to saturated fats, it's still higher in omega-3. Here's other fish. Now, look, what's the highest saturated fat? The highest saturated fat is herring. When they talk about fish not to have because of uric acid, they talk about herring, mackerel, and sardines. So look at this. The ratio of saturated fats to omega-3, as much as they have omega-3, still higher in saturated fats. Mackerel, still higher in saturated fats. Sardines, still higher in saturated fats. Isn't that interesting? So the lowest saturated fat fish would be, well, here's tuna. So organ meats, eating head to tail, where can we go wrong? Now you know. It's because there's very little in omega-3, very high omega-6, that brings in reabsorbs a lot of the uric acid. So now if you're getting a lot of uric acid from all those processed foods and so on, that's a problem. So if you corrected this one thing, probably not a problem. Okay, so treatment for gout, uric acid, have levels below 5.5 for sure. So what they call uricosic agents, which help reabsorb. So what I just told you about, also there's medicine you can take that does that tends to help you reabsorb less. That's the omega-6/3, of course, and compared to your saturated fats. Quercetin, potassium citrate. Potassium citrate is famous for preventing kidney stones caused by elevated uric acid. Vitamin C, lutein, which is another flavonoid, and there's other things out there too. This was covered in Chinese medicine and wherever you want to go. Xanthine oxidase inhibitors to help your body make less uric acid, right? We saw that, inhibits that. Decrease consumption of food, increase uric acid, fructose, vitamin A. Lutein, the benefits of lutein are antioxidants, anti-inflammatory. It's a flavonoid from olives and I think oranges as well. And vitamin C is pretty much the same thing. Higher vitamin C, here's a study, independently associated with lower risk of gout by lowering uric acid. I would focus on the 6/3, which you haven't heard before, and you should be on your way. So if this is the kind of video that you like, that we go deeper into a smaller area that has a lot of relevance to a particular population, let me know. Because my way is going, what are the labs about? What's the research about? Let's be real. It's just not hypothetical. It's not like, oh, I've read 10 different abstracts and therefore this is the conclusion. I take that idea and let's look at the labs. Do the labs tell the story that we have just learned about in these particular studies? If they do, that's a home run. If not, then it's too esoteric. But let me know if this is something you're interested in. Thanks.